One of the most common problems I encounter in clinic is advanced knee arthritis or chronic knee pain. A lot of patients have come to see me with knee pain they've had for months or even years, and they're significantly limited in their quality of life. They can no longer participate in activities they used to enjoy with family or friends. Perhaps they've tried conservative management, injections, medications, whether it's over-the-counter or prescription, weight loss, exercise, you name it. A lot of patients come to see me at a point where they've had enough, they're done. One of the best options to consider at that point is a knee replacement. Knee replacement is one of the most successful surgeries in all of medicine. That's part of the reason I really enjoy being an orthopedic surgeon, is patients do very well most of the time. So a knee replacement is usually about an hour or two surgery. And what we do is it's more of a resurfacing of an arthritic knee. A lot of patients are curious what arthritis is, and a common misconception is that arthritis is when something actually grows in the knee. But in actuality, arthritis is more of a wear and tear condition, where the articular cartilage or the lining of the cartilage surface where the bones rub together starts to wear away. I always equate it to patients like wearing tread on a tire. So one of the most successful treatments for advanced knee or hip arthritis is a joint replacement. And joint replacement is extremely successful, and it's one of the main reasons I really enjoy my job, is because patients do very well. So one of the main treatments for end-stage arthritis that's failed all conservative measures is a knee replacement. And this is a model of a knee replacement. You can see the metal cap on the end of the femur, the plastic in between, that's your new joint surface or cartilage, and a metal tray inside the tibia. So rather than walking bone on bone with a bow leg or knock knee, patients are now walking metal on plastic and often have a nice straight leg. Knee replacement's a big decision. It's a large surgery. Many patients have a lot of anxiety and uncertainty if it's the right surgery for them to have at this point in their life. They have a lot of questions that they have. I would encourage you, if you have questions, if you're thinking about knee replacement, come see me at Reedsburg Area Medical Center and we can talk about options for you. Maybe surgery is the right decision, maybe it's not. I'm happy to help you along your journey, and we can make an informed decision together and do what's best for you to get back to the activities you enjoy.